Okay, Jonathan. Based on what you've told me, I think there are a number of options for your treatment and what we can do next. And what would be best is if we could discuss these and come up with a plan together.
Okay,
Okay?
sounds good.
So I suspect that you have a kidney stone,
Right.
which is a stone that forms inside your kidney and passes down a tube into your bladder. And the pain that you feel is the tube sort of squeezing around that stone. Okay? So what I'd like to do now is test your urine to see if there's any evidence of blood or infection, and actually do some blood tests as well, which I think would be sensible, just to make sure that your kidneys are working properly.
Yeah.
Have you ever had a blood test before?
Yeah, it was. I mean, it was quite a long time ago, but yeah, I can't really remember how it worked. To be
Okay,
honest.
okay. So we use a small needle to take a
Yeah.
sample of blood. It might hurt a little bit, and it might leave you with a bruise, but other than that, nothing.
Okay.
Okay? And this will give us a good impression as to whether your kidneys are working properly.
Right. Okay.
Is that okay?
Yeah. Yeah. That sounds fine.
All right. So we'd also like to do a CT scan, which will help me identify if there is a kidney stone and if it's causing any problems. Okay? And it will also help us gauge the size of the kidney stone and formulate your management plan for the future.
Right. Okay. And I mean, are there any risks with that then, the CT scan?
So the scan does use X-rays, which is radiation, so there is a small risk that in large doses it can cause cancer,
Right. Okay.
but the dose that we're using with you is quite small.
Okay. Okay. And so is that our only option then, or have we got other options?
There are other options. We could use, for example, an X-ray or an ultrasound, but these are not as good at identifying kidney stones, even if there is less radiation used, and it won't allow us to plan your future management quite as well.
Right. Okay.
Okay, so what do you think?
Yeah. I mean, I guess if that's if you think that's the best option, to have the bloods done and then the CT scan, then I want to do the best thing.
Okay,
So yeah, I'm happy to go with that.
but before we do these investigations, do you have any questions?
Just how long does it take then?
You shouldn't really be in the scanner for any longer than 5 minutes.
Right, okay. So not too bad.
No. Any other questions?
No, I don't think so.
Okay, thank you, Jonathan.
Right.